Hello everyone, and welcome to the Simulation in Physical Therapy Education Consortium's Simulation 101. Whether you're just beginning to think about utilizing simulation or you've been using sim for years, it's helpful for us to all have common terminology. In this presentation, we're going to share some basic simulation terms and concepts. Let's get started. Let's take a look at the learning objectives. After this presentation, you'll be able to define simulation-based learning experiences, or SBLEs. You'll also be able to discuss the standards of best practice for simulation and identify the necessary components of SBLEs. You'll be able to compare and contrast various modalities of SBLEs, specifically simulated patients, standardized patients, and human patient simulators. And finally, you'll be able to define simulation fidelity and contrast psychological and engineering fidelity related to SBLEs. This presentation is not intended to provide training or certification in simulation-based education, but rather to serve as a foundation for PT educators to have a common starting point and common terminology when discussing simulation-based teaching and learning. Common language is of critical importance in healthcare, and simulation is no different. So where do we find these definitions? The Society for Simulation in Healthcare has published the Healthcare Simulation Dictionary. This is a free resource and can be found at this web address. All of the definitions in this presentation were taken from this fabulous resource. So what is simulation? Simulation is a technique that creates a situation or environment to allow persons to experience a representation of a real event for the purpose of practice, learning, evaluation, testing, or to gain understanding of systems or human actions. Similarly, simulation-based learning experiences are an array of structured activities that represent actual or potential situations in education and practice. These activities allow participants to develop or enhance their knowledge, skills, and attitudes, or to analyze and respond to realistic situations in a simulated environment. So what does this mean? Well, simulation is a term that represents a pedagogical approach to learning. In other words, simulation is a teaching technique, like lecture, flipped classroom, or problem-based learning. Simulation-based learning experiences, or SBLEs, are the actual structured activities that learners participate in to develop their skills. So now that you know the definition of simulation, how is this different from the role-play activities that PT educators have been performing in lab for decades? In other words, what is the difference between simulation and role-play? To answer this question, let's take a look at the standards of best practice for simulation. So far, we have introduced you to the Society for Simulation in Healthcare and their wonderful Healthcare Simulation Dictionary. It is time to introduce you to another useful resource. This one comes from the International Nursing Association for Clinical Simulation and Learning, or INACSL. In 2016, INACSL published Standards of Best Practice for Simulation. These evidence-based guidelines are available for free at the website listed here. INACSL describes 8 standards of best practice. In this presentation, we're going to highlight 2 of them: simulation design and debriefing. First, let's talk about simulation design. According to INACSL, standardized sim design provides a framework for developing effective simulation-based learning experiences. The design of SBLEs incorporates best practices from adult learning, education, instructional design, clinical standards of care, evaluation, and simulation pedagogy. Purposeful simulation design provides a vital structure to the process that can facilitate consistent outcomes and enhance the value of the SBLE. According to INACSL, in order to enhance the effectiveness of SBLEs and achieve anticipated outcomes, the design and development of simulations should consider the following 11 criteria. Perform a needs assessment to provide the foundational evidence of the need for a well-designed simulation-based experience. You want to know why you are adding this learning activity to your curriculum. Construct measurable objectives. Each simulated learning experience should have very clear, specific objectives that will help guide the development of the activity. Structure the format of a simulation based on the purpose, theory, and modality for the simulation-based experience. While we're not going to go into a discussion about this here, this is a very important step. You should always have a reason for choosing what you choose. We don't want to fall into the trap of using mannequin-based simulation simply because it's available to you, when a simulated patient might help you meet your objectives in a better way. Design a scenario or case to provide the context for the simulation-based experience. Again, case design will be based on learning objectives, not the other way around. Sometimes people will say, oh, I have a great case you can use. But if it doesn't meet your learning objectives, it's not the right case for you. Use various types of fidelity to create the required perception of realism. We're going to talk more about this shortly. Maintain a facilitative approach that is participant-centered and driven by the objectives, participants' knowledge or level of experience, and the expected outcomes. A facilitative approach means that you are guiding the learners through the learning experience that is based upon their actions and reflections. You are not directly teaching. Begin simulation-based experiences with a pre-briefing. We will be discussing this shortly. Follow simulation-based experiences with a debriefing and/or feedback session. We will also describe this in the coming slides. Include an evaluation of the participants, facilitators, the simulation-based experience, the facility, and the support team. It's important to assess the learning experience from multiple perspectives. Provide preparation materials and resources to promote participants' ability to meet identified objectives and achieve expected outcomes of the simulation-based experience. This is often done prior to or during the pre-brief. It's important to remember that simulation is used to integrate knowledge and skills, but not for initial teaching or introduction of material. Learners need to be prepared with the foundational and background knowledge and skills in order to successfully perform during the simulation. Pilot test simulation-based experiences before full implementation. This is a critical step. There are a lot of moving pieces with orchestrating a simulation. It can be thought of as putting together a stage production. It's really important that you practice first before having your learners participate in the sim. So, an Axel is telling us that all of these criteria must be met in order to meet the standards of best practice for simulation design. So again, we ask, what is the difference between simulation and role play? The presence of the criteria previously listed, particularly the pre-brief and debrief, which we're going to discuss momentarily, is what distinguishes simulation from basic role play. Think about it this way. While most SBLEs include some type of role play, not all role play can be considered simulation. Let's review those most critical components of simulation-based learning experiences: pre-brief, clinical scenario, and the debrief. Simulation-based learning experiences begin with a pre-brief. According to the Healthcare Simulation Dictionary, a pre-brief is an information or orientation session held prior to the start of a simulation activity in which instructions or preparatory information is given to the participants. The purpose of the pre-briefing is to set the stage for a scenario and assist participants in achieving scenario objectives. It is essential to establish ground rules with simulation participants. The pre-brief is where you can review the learning objectives, highlight the events of the simulation, and most importantly, express the importance of suspending disbelief during the simulated event. In other words, treat everyone and everything in the simulation as if you were in a real situation and act accordingly. It is also valuable to review the concept of confidentiality and develop a safe space. What happens in Vegas stays in Vegas. Well, what happens during a simulation stays in the simulation. Developing ground rules on a safe space gives the students permission to act as they think they should act, given the scenario, not act like they think you want them to. It gives them the ability to try, to perform without fear of negative consequences, and it develops trust between you and the learners. After the pre-brief, the learners are ready to participate in the simulated event. This clinical scenario is highly structured. According to the Healthcare Simulation Dictionary, a clinical scenario is a detailed outline of a clinical encounter that includes the participants in the event, briefing notes, goals and learning objectives, participant instructions, patient information, environmental conditions, mannequin or standardized patient preparation, related equipment, props, tools, or resources for assessing and managing the simulated experience. In other words, every aspect of the simulated event should be carefully planned in advance. The SBLE should be standardized so that it can be easily replicated. So here we see a human actor-based simulation in which the learners are wearing PPE while participating in an SBLE in a simulated hospital room with a simulated patient with mock lines and tubes. In a scenario like this, the patient's responses would be pre-planned based upon the learning objectives. If, for example, your learning objectives were about patient safety, the patient would lose their balance while seated at the edge of the bed, requiring the learners to appropriately guard. If your learning objective was about recognizing and responding to physiologic measures, the patient could become orthostatic while seated. Each element is planned in advance. After participating in the simulation event, students must participate in a debrief. According to the Healthcare Simulation Dictionary, a debrief is a formal, collaborative, reflective process within the simulation learning activity. Debrief is also defined as a verb. To debrief is to conduct a session after a simulation event where educators, instructors, facilitators, and learners re-examine the simulation experience for the purpose of moving toward assimilation and accommodation of learning to future situations. Debriefing should foster the development of clinical judgment and critical thinking skills. The debriefing is really where the learning occurs. Let's take a look at ENACSL's standard of best practice related to debriefing. ENACSL lists 5 criteria related to best practice in debriefing. The debrief is facilitated by a person competent in the process of debriefing. Debriefing takes skills and practice like anything else, and facilitators should be trained. The debrief is conducted in an environment that is conducive to learning and supports confidentiality, trust, open communication, self-analysis, feedback, and reflection. This trust was established in the Prebrief when you created that safe learning environment. The debrief is facilitated by a person who can devote enough concentrated attention during the simulation to effectively debrief the simulation-based experience. The debrief is based on a theoretical framework for debriefing that is structured in a purposeful way. The debrief is congruent with the objectives and outcomes of the simulation-based experience. Basically, the debrief is a large group facilitated discussion in which the learners reflect on and discuss the simulated event with instructor guidance. If you are interested in learning more about debriefing, there have been many articles published regarding different frameworks for debriefing, and there are also continuing education courses for debriefer training. We highly recommend seeking further education on facilitating the debrief, as there is evidence that suggests that this is where the learning happens. Let's move on to discuss the various modalities of simulation. The first is paper-based simulation, also known as tabletop simulation. This is an educational tool intended to provide students or learners an opportunity to apply knowledge through formal discussion of a described scenario. An example of a tabletop simulation might be an interprofessional team meeting. Again, this is different from traditional paper case studies in that all of the criteria for simulation design are met. In other words, the activity includes a pre-brief and a debrief. Paper-based simulations can be easily adapted to remote learning environments. We also have computer-based simulation. This is the modeling of real-life processes with inputs and outputs exclusively confined to a computer, usually associated with a monitor and a keyboard or other simple assistive device. Subsets of computer-based simulation include virtual patients, virtual reality task trainers, and immersive virtual reality simulation. Next, we have human actor-based simulation. In healthcare simulation, this is when professional and/or amateur people are trained to reproduce the components of real clinical experience, especially involving communication between health professionals and patients or colleagues. We're going to discuss this more in just a bit. Finally, we have mannequin-based simulation. This is the use of mannequins to represent a patient using heart and lung sounds, palpable pulses, voice interaction, movement, bleeding, and other human capabilities that may be controlled by a simulationist using computers and software. Let's delve a little deeper into portraying the patient during simulation. You may have heard the terms simulated patient and standardized patient in simulation literature. Let's look at the definitions of these two terms. A simulated patient is a person who has been carefully coached to simulate an actual patient so accurately that the simulation cannot be detected by a skilled clinician. In performing the simulated patient presents the gestalt of the patient being simulated, not just the history, but the body language, the physical findings, and the emotional and personality characteristics as well. A standardized patient is an individual trained to portray a patient with a specific condition in a realistic, standardized, and repeatable way, and where portrayal presentation varies based only on learner performance. This strict standardization of performance in a simulated session is what can distinguish standardized patients from simulated patients who have little more freedom to flexibly respond to the learners, although the terms are often used interchangeably. Volunteers, teaching assistants, and instructors can all be simulated patients at little to no cost. Actors can also be hired to portray patients for a fee. A mannequin is a life-size human-like simulator representing a patient for healthcare simulation and education, including full or partial body simulators that can have varying levels of physiologic function and fidelity. A major downside to the use of mannequins is the significant cost of these devices. Another issue in physical therapy education is the lack of mobility and limited articulating joints of the mannequin, leading to a decrease in fidelity. Let's talk a little bit more about fidelity. Fidelity is the level of realism associated with a particular simulation activity. According to the Healthcare Simulation Dictionary, fidelity can involve a variety of dimensions, including physical factors such as environment, equipment, and related tools, psychological factors such as emotions, beliefs, and self-awareness of participants, social factors such as participant and instructor motivation and goals, the culture of the group, the degree of openness and trust, and participants' modes of thinking. Let's explore this concept a little further. You may have heard the term high-fidelity simulation in the literature. High-fidelity SBLEs are defined as simulation experiences that are extremely realistic and provide a high level of interactivity and realism for the learner. Low-fidelity SBLEs are defined as not needing to be controlled or programmed externally for the learner to participate. These definitions can be a bit confusing because they're not necessarily opposites. For example, it is possible to have a simulation that requires no external controls, low fidelity, that engages the learner in a highly realistic event, high fidelity. It is for this reason that many researchers are breaking up fidelity into two types, psychological fidelity and engineering fidelity. Psychological fidelity is the degree of perceived realism, including psychological factors such as emotions, beliefs, and self-awareness of participants in simulation scenarios. In other words, how well the scenario mimics the thoughts, emotions, and behaviors inherent in the task. Did the learner think it felt real, like they were immersed in a real scenario? On the other hand, engineering or physical fidelity is the degree to which the simulation looks, sounds, and feels like the actual task. So here, we're really referring to the physical environment. Research has shown that psychological fidelity might be more important than engineering fidelity for meaningful learning. So this concludes our Simulation 101 presentation today. Now that you've watched this video, please register for a Q&A session on the ACAPT upcoming events page. These Q&A sessions are an opportunity for you to ask any questions you have about the material in this talk and engage in dialogue with one of SIPTEC's board members about simulation-based learning. In addition to this, we recommend that you utilize available resources to further your knowledge and skills. Seek resources within your own university and use the resources that we highlighted in this presentation: AXL, the Society for Simulation in Healthcare, and the Healthcare Simulation Dictionary. Seek out training opportunities in simulation design, delivery, or debriefing. And most importantly, join SIPTEC. Here are the references used in this presentation. We encourage you to take time to review them. We would like to quickly acknowledge the people who contributed to this presentation. Thank you for your attention. We're looking forward to seeing you at the Q&A.